Since the turn of the century, that is to say the last one, there's been a substantial increase in the number of new diagnoses amongst men who have sex with men in New Zealand. And much of that increase has happened amongst people who are infected in New Zealand. And over the last 10 years, that number has gone up by 2.5 times. So we've seen a really big change over the last decade. And in fact, to be quite specific, it's actually a 3-year period in there where most of the change happened between 2002 and 2005. And that sort of change, big increase in new HIV infections amongst MSM, has been seen all the way around the world in equivalent populations of men who have sex with men over the same time period. Most of the transmission of HIV that happens in New Zealand is occurring amongst men who have sex with men. That is not in any other population group. And if you think of homosexual men, gay and bisexual men as accounting for about 5% of the male population, 2.5% of the overall population. Over the last 5 years, we've accounted for 79% of the HIV diagnoses where infection occurred here. In other words, 2.5% of the population accounts for 79%, which means we bear the overwhelming burden of new cases of HIV infection in New Zealand over that time frame. A similar picture to that is occurring all around the world over the same sort of time period in STI infections, sexually transmitted diseases, in other words, amongst gay and bisexual men, amongst men who have sex with men. So what we're talking about here is syphilis and gonorrhea and chlamydia, and over the same time periods those have been going up also very sharply. We haven't seen the same sorts of increases yet here, but evidence overseas indicates that if we follow the same time trends, that's what's going to happen here as well. We've realised recently that wherever you look around the world, gay and bisexual men are bear the greatest burden of HIV risk and STI risk. And this is apparent even though currently half the member countries of the United Nations don't collect any information about HIV or STI risk for the men who have sex with men, their gay male populations. And also 85 countries in the UN have still got legal sanctions against homosexuality. So even though we don't have a lot of data from a lot of developing countries, it's very clear that gay and bisexual men bear the greatest risk around these two areas, which is HIV and STI. The main underlying reason for this data that we're seeing everywhere is the very high risk associated with anal sex as far as both HIV and a large number of the other STIs are concerned. The risk's particularly high with receptive anal sex. That particular sexual behaviour has approximately 5 times the risk of HIV transmission that any other sexual behaviour does. So this accounts for why the numbers look like they do. Fortunately, we have an answer to this problem. We've known for nearly 20 years now that condoms are extremely effective in reducing the spread of HIV. In fact, in the context of anal sex, we're looking at a 95% reduction in risk by the consistent and proper use of condoms. So that's massive and extremely effective. If New Zealand MSM forget the hard lessons that we learnt 25 years ago, then we are going to return to a steady increase in HIV, new HIV infections and in STI infections. The answer really is very much in our hands, both individually and collectively, because this epidemic, that is the one of HIV and any associated STI epidemics, are entirely preventable. And it's up to individuals to take the steps necessary to protect their own health and that of their sexual partners.
Well, we're involved in 2 major research programs this year. First of all, over 1,500 gay and bisexual men in Takatapui took part in the 2008 biannual GAP survey, and a further 1,500 also completed the online GOS survey through internet dating sites nationwide. This was a record response for GAPS, due in large part to the fantastic recruitment team led by John Roden, and of course the enormous goodwill of gay and bisexual men in Takatapui themselves, who are often approached at inconvenient times at either the Big Gay Out, gay bars or saunas in Auckland. GAPS is a very important research program. It's the major study of sexual practices, sexual partnering, HIV testing, knowledge and attitudes amongst this population. It's led by the research unit here at NZAF in collaboration with the AIDS epidemiology group at the University of Otago. We use gaps and goss both as a periscope to look ahead and see whether there are any shifts potentially occurring in risk of transmission. And we also use it as an assessment tool to evaluate previous prevention campaigns and tell us where some types of MSM are potentially being underserved by HIV prevention. For example, we've found from previous GAP surveys that men recruited online through internet dating sites report greater rates of unprotected sex, lower rates of testing, lower levels of knowledge about HIV, and more problematic attitudes towards safe sex compared to men recruited offline in the bars and venues. Throughout the year we've held seminars, given conference papers and written articles about the findings from the GAPS program up until this point. And the findings from the 2008 survey will be reported early in 2009. 261 people living with HIV completed HIV Futures New Zealand 2 in 2007. This was the follow-up survey to the first HIV Futures New Zealand survey, which was held 5 or 6 years ago, and was led by the Australian Research Centre in Sex, Health and Society at La Trobe University, Melbourne. Major findings included a reduction in difficulties associated with the new treatments, fewer side effects and shorter treatment breaks. At the same time, there was a gradual return to work amongst people living with HIV, particularly into full-time paid employment, and also a reduction in the needs around service provision, particularly around issues such as personal counselling. These findings from HIV Futures New Zealand paint a generally improving picture about living with HIV in New Zealand, or certainly certain aspects of living with HIV. But at the same time we have to remember that the number of people living with HIV in this country is increasing because of improved treatments and lower mortality from HIV. And this in turn places different and new demands on HIV services, both in terms of the types of services needed and also the volume of services required.
Well, this year there's been quite a few changes, particularly between Auckland and Wellington in relation to 2 new locations for their support and counselling facilities. This has been done so that we can actually increase the services that we are offering to our population group. Particularly here in Auckland, our numbers have increased quite considerably in relation to testing, but in more for people who are positive and also negative men accessing our services, 22% and 27% respectively increased, which is really great. And also